Welcome to the Victory Education Lounge. I'm your host, Maurice, and we're thrilled to have you join us for another exciting episode. Before we dive in, don't forget to like, subscribe, and leave a comment below sharing your thoughts or experiences. Your engagement helps us create more valuable content for you. Today, we're exploring part 126 of our series, the role of medications, metformin, and beyond. While lifestyle changes are fundamental in managing insulin resistance and type 2 diabetes, medications play a crucial role for many individuals. Let's dive into the world of diabetes medications, focusing on metformin and other options available. Ever wondered how medications play a role in managing diabetes? Welcome to another episode of our series, The Role of Medications, Metformin, and Beyond. This is part 126, and today we're taking a deep dive into the complex world of diabetes medications. From improving insulin sensitivity to controlling glucose levels, medications can be a game changer for many individuals. But remember, they are not a standalone solution. They work best when combined with a healthy lifestyle. In our journey today, we'll explore 7 common medications, starting with metformin, and discuss their pros and cons. But before we move forward, here's a vital disclaimer. This video is for entertainment and educational purposes only. For any health-related decisions, especially those involving medications, always consult your healthcare provider. So let's embark on this journey. And remember, always consult your healthcare provider before making any changes to your medication. Medications are typically prescribed when lifestyle changes alone aren't sufficient to manage blood sugar levels. These pharmaceutical aids are pivotal in the battle against diabetes, working in myriad ways to control glucose levels and improve insulin sensitivity. They aren't a one-size-fits-all solution, but rather a vast array of options tailored to individual needs, health profiles, and specific diabetes types. Among the commonly prescribed medications, 7 are particularly notable. First off, we have metformin, a front-runner in the fight against type 2 diabetes. Then we have sulfonylureas, DPP-4 inhibitors, GLP-1 receptor agonists, SGLT2 inhibitors, Thiazolidinediones, and lastly, the well-known insulin. Each of these medications has its unique benefits and potential side effects, providing a range of options for healthcare providers and patients to consider. Now that we've set the stage, it's time to delve deeper into these medications. Let's start with a closer look at metformin, a first-line defense against type 2 diabetes. First up, metformin, the first-line treatment for type 2 diabetes. Metformin is often the go-to medication because it works by improving insulin sensitivity. This means it helps your body use insulin more effectively, which in turn helps control your blood sugar levels. Some people may even experience the added benefit of weight loss when taking metformin. However, it's not all sunshine and roses. Metformin can cause some gastrointestinal side effects such as nausea or diarrhea. It's also worth noting that long-term use of metformin may lead to vitamin B12 deficiency. Let's put this into perspective. A study found that metformin can reduce the risk of diabetes onset by 31% in people with prediabetes. This shows how effective it can be in managing insulin resistance and blood sugar levels. Next, let's explore sulfonylureas. Sulfonylureas, like glipizide and glyburide, stimulate insulin production. They are a class of drugs that have been around for quite some time and are often used effectively in the management of type 2 diabetes. But, as with any medication, they come with their pros and cons. On the positive side, sulfonylureas work rapidly to lower blood sugar levels, which can be particularly useful in acute scenarios. However, they are not without their drawbacks. They can cause weight gain and carry a risk of hypoglycemia or low blood sugar. These side effects can be a concern for some individuals, particularly those who are already struggling with weight management or who have other conditions that could be exacerbated by hypoglycemia. To illustrate their effectiveness, research has shown that sulfonylureas can lower A1C levels, a long-term measure of blood sugar control, by 1 to 2%. Now, let's take a look at DPP-4 inhibitors. DPP-4 inhibitors, such as sitagliptin and linagliptin, are weight neutral. These medications are a popular choice due to their minimal effect on body weight. Additionally, they present a low risk of hypoglycemia, a serious condition where blood sugar levels drop below normal. However, every silver lining has a cloud, and DPP-4 inhibitors are no different. While they do not contribute to weight gain, they can be relatively expensive, which may be a deterrent for some. Additionally, they may cause joint pain in some individuals. Despite these potential drawbacks, DPP-4 inhibitors have proven effective in managing type 2 diabetes. For instance, Studies have shown that these medications can reduce A1C levels by 0.5 to 0.8%. This indicates that they can play a significant role in maintaining healthy blood glucose levels. Next up, let's explore another class of medications called GLP-1 receptor agonists. GLP-1 receptor. Agonists, like liraglutide and semaglutide, promote weight loss. These medications are unique because they mimic the function of a hormone in your body called glucagon, like peptide 1. This hormone slows digestion, helps lower blood sugar levels, and even contributes to feelings of fullness, which can aid in weight loss. However, they're not without their drawbacks. For one, most GLP-1 receptor agonists need to be administered by injection, except for oral semaglutide. They can also cause nausea and other gastrointestinal side effects, particularly at the beginning of treatment. Despite these potential side effects, their benefits are considerable. For instance, they're known to lower the risk of cardiovascular events, a significant concern for many people with type 2 diabetes. In terms of their effectiveness, some GLP-1 receptor agonists have shown to reduce A1C levels by up to 1.8%. That's a substantial decrease, making these medications a powerful tool in the fight against diabetes. Let's move on to SGLT2 inhibitors. SGLT2 inhibitors, such as empagliflozin and dapagliflozin, also promote weight loss. These are relatively newer drugs in the diabetes management toolbox, but they've already made a significant impact. They work by blocking a protein in the kidneys, which allows the body to expel excess glucose through urine. This unique mechanism not only helps control blood sugar levels, but also offers additional benefits. For instance, they've been found to provide cardiovascular and kidney benefits, which is a boon for people with diabetes who often face these complications. However, they are not without their drawbacks. They can increase the risk of genital yeast infections and, in rare cases, may increase the risk of diabetic ketoacidosis, a serious condition where the body starts breaking down fat at an unhealthy rate. To illustrate their effectiveness, studies have shown that SGLT2 inhibitors can reduce A1C levels by 0.5 to 1%. Next, we'll discuss Thiazolidinediones. Thiazolidinediones, like pioglitazone, improve insulin sensitivity. These drugs work by activating a specific type of receptor in fat cells, which in turn helps the body use insulin more effectively. This means that your cells can take in and use glucose from your bloodstream more efficiently. Now, as with all medications, Thiazolidinediones come with both benefits and potential drawbacks. On the plus side, they do improve insulin sensitivity, and some studies suggest they may also have cardiovascular benefits. However, they are not without their cons. Thiazolidinediones can cause weight gain, which can be a significant downside for some individuals. Additionally, there's a risk they may increase the likelihood of heart failure in certain patients. In terms of their effectiveness, studies have shown that thiazolidinediones can lower A1C levels, a key marker of blood sugar control, by between 0.5% and 1.4%. Finally, let's talk about insulin. Insulin, a highly effective medication at lowering blood sugar. This hormone replacement therapy can be tailored to meet individual needs, making it a versatile tool in managing diabetes. On the upside, insulin is extremely effective and can drastically lower blood glucose levels, bringing them back to the normal range. It's important to note, the effectiveness of insulin therapy can vary widely depending on the individual and the specific regimen followed. However, insulin therapy does come with its own set of challenges. It requires injections or the use of a pump, which can be inconvenient and may lead to discomfort. Additionally, there's a risk of hypoglycemia or low blood sugar, if not properly managed. Weight gain is another common side effect associated with insulin use. In terms of its effectiveness, insulin therapy can lower A1C levels by 1.5 to 3.5% or more. Again, depending on the individual and regimen. Let's wrap up our discussion on these medications. We've explored a variety of medications today, each with its unique benefits and considerations. From the first-line treatment, Metformin, to the power of insulin, these medications play a significant role in managing insulin resistance and type 2 diabetes. We've also delved into other options like sulfonylureas, DPP-4 inhibitors, GLP-1 receptor agonists, SGLT2 inhibitors, and thiazolidinediones. It's clear that the landscape of diabetes management is rich and diverse, offering options tailored to individual needs and circumstances. However, it's crucial to remember that any decision involving medications should be made in consultation with a healthcare provider. They can help you understand the benefits, potential side effects, and the most effective way to incorporate these medications into your diabetes management plan. Thanks for joining us today. In conclusion, medications like Metformin and others can be game changers in managing insulin resistance and type 2 diabetes. By working closely with your healthcare provider to find the right medication regimen, combined with a healthy lifestyle, you can effectively manage your blood sugar levels and reduce the risk of diabetes-related complications. Remember, every step you take in managing your diabetes counts towards a healthier, more balanced you. Thank you for joining us in the Victory Education Lounge. If you found this video helpful, please give it a thumbs up and share it with friends who might benefit. Don't forget to subscribe for more content on health, wellness, and personal development. Until next time, stay informed, stay healthy, and keep striving for victory in all aspects of your life. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications. Stay tuned for our next episode.